The Competition Commission said today that Ampath and Lancet laboratories have agreed not to charge more than 500 rand for a PCR Covid-19 test. Smaller labs are also expected to follow suit. To talk more about this, we're joined by public health lawyer Safura Abdul Karim. Safura, very good evening to you. Welcome to News at Prime. So, could the issue of pricing of Covid-19 testing, especially the PCRs, could it be looked at as a health rights issue?
Undoubtedly. We know that the cost of PCR tests have been prohibitive, among other things, and there's a high reliance on private labs and private testing, particularly for people who are traveling and who need PCR tests for medical reasons. So this is really an incredible victory for public health as well as for broader access to healthcare.
We had the Council for Medical Schemes raising the issue with the Competition Commission about a month or two ago. Now that we've got this announcement and agreement to lower prices from 850 to 500, is there still room for legal action outside the competition framework?
You know, I think the first thing to note is that this reduction is quite long overdue. There were discussions as early as the middle of last year to attempt to reduce the cost of these tests because they are very expensive, and everyone expected that the cost of these tests would reduce over time, and we didn't see that. Thank goodness the Council for Medical Schemes did bring this to the attention of the Competition Commission, and what we would hope is that, yes, the two biggest labs are lowering their prices and smaller labs should follow suit. But what we'll also hope to see is a further reduction of the cost of these tests as time goes by. This 500 rand is not an endpoint. It is clearly a compromise to reach a settlement. But if there is evidence of anti-competitive behavior or price fixing, there's no doubt in my mind that there would be room to approach the Competition Commission once more.
Did government drop the ball on this then? Because it's one thing to say at the beginning of the pandemic, people were paying upward of 1,000 rand for a test, yes, and then there was discussion with the two labs and I think the Minister of Health at the time, which eventually led to the agreement on 850. But still, we're almost 2 years into the pandemic, and there's very much a sense among people that these prices should have come down a long time ago.
I think perhaps there was a level too much of deference to private labs and private actors in hopes that they would, of their own volition, make testing affordable. Really what this represents is the fact that they would not do so without prodding, and so we need government and ourselves as the public to be very vigilant about this issue, because clearly they would have been able to reduce the price of these a long time ago. They've just done so at the nudging and prompting of the Competition Commission. So I do think we do need to be vigilant about this and make sure that we are holding these actors accountable, because the tests are incredibly important.
How do we avoid a repeat of this, Safura?
I think the biggest thing is we need to ensure that government is constantly engaging with private labs and private actors around the cost of these different initiatives. Tests are just one small part of this, but of course we've had issues around PPE being overpriced, and there's been corruption there. We just need to ensure there's only a handful of labs in South Africa, so we just need to watch those actors. We need to benchmark it against what people internationally are paying. We need to be mindful of what the cost of these tests realistically are. And the great thing is there is a public lab service, so that also provides an indication and benchmark to government and to us of what these tests should be costing.
Safura Abdul Karim, grateful for your time. Thank you so much.